And after she came down with a fever, we had her tested for COVID-19 and her results came back positive. Maya is doing fine and her symptoms are mild. And my wife and I have both been tested and our test results have come back negative. But as we monitor Maya's symptoms and take care of her, my family is going through what so many families across this city and this nation and around the world are experiencing. And we're doing exactly what our public health officials have asked us to do after a COVID-19 exposure. Maya will isolate for at least 10 days from the time that her symptoms first appeared. And Amy and I are quarantining in accordance with public health guidelines. And I will continue to conduct the business of our city every day, but I'll do it remotely. I promised you all at the beginning of this pandemic that I and your city government would never stop working for you to confront this pandemic and to save lives and livelihoods. And in this, our toughest moment, that still remains true. Our family is incredibly careful. And what's happening in my home this week is playing out across Los Angeles and this country. As our city approaches 3 million tests administered, we've increased testing capacity to meet the moment, providing Angelenos with 41,500 tests each day. Unfortunately, our city test sites are seeing a 7-day positivity rate of an alarming 19.6%. And some of our sites have a positivity rate as high as 30%. This virus is hitting so many families, more Angelenos, more now at this point than at any moment during this crisis. 3 hours ago, hopefully, the Food and Drug Administration's Vaccine Advisory Committee endorsed the Moderna vaccine, and I expect the FDA to give its final approval in the coming days. By the beginning of next week, what that means for us here is there will be more than 6 million doses of this new vaccine shipped throughout the country, in addition to the Pfizer vaccine. I had the privilege early this week of witnessing the first frontline medical workers get vaccinated over at Kaiser Sunset Hospital. It was an incredibly moving moment where I witnessed the hope of today. But we also each day confront the horror of today, of the numbers that come in that represent lives changed and lives lost. The United States is losing more than one person to COVID-19 every minute. And we're losing more souls than died on 9/11 every single day. California recorded a one-day record of 379 deaths. And yesterday was the single worst day of cases and deaths ever recorded in Los Angeles. More than one person dying every 15 minutes from COVID-19. Today was the second worst. And cases are double what they were just last week and 6 times higher than they were last month. The truth is what you do individually is more powerful than anything we can do in government. What you do is even more powerful than the vaccine. And we need you. We need you to be the heroes on the front lines of this fight tonight. The most important thing you can do right now is to wear masks, to stop gathering with others and to stay home whenever you can. Because simply getting together with others, whether it's one Christmas or New Year's gathering or party, could be disastrous. If even a small portion of this county and our city does that, cases will skyrocket even higher. And more tragically, so will the numbers. Because we know when infections rise, so do hospitalizations. And when hospitalizations rise, so too do deaths. Right now, we have 5,100 people in Los Angeles County hospitalized for COVID-19, a 5% increase just since yesterday. It's double the number that were hospitalized a month ago. And worse, 1,035 of them are in the ICU. Put simply, there are more people in the ICU today than all the COVID-19 hospitalizations about a month ago. And today we learned that Southern California's hospital ICU beds are now at 0% capacity, as reported by the state hospital census. You'll remember I talked to you about that happening maybe as early as Christmas. It's here even earlier. My staff and I are in frequent contact with hospital leaders and administrators, and their message could not be more clear. While they do have the capacity to add some more beds, it's very difficult to add more people in a country where there's a medical staff shortage. Across the country, hospitals are reporting hundreds of healthcare staff who are on medical leave because they have COVID, because they've been on the front lines. One hospital administrator conveyed to me in a Zoom call that if we see a similar spike after Christmas, and these were his words, we will go under. We will go under. To put it in starker relief, the state has ordered 5,000 extra body bags and additional refrigerated units for Los Angeles and triggered what's called mutual aid for coroners in our region. That means that we expect to have more dead bodies than we have spaces in morgues for them. And now we'll have to share resources across county lines. That frightens me, and it should frighten you. But it should also prepare us for the action that we have to continue. I implore you to prevent hospitals from being stretched even more than they are today. This, my fellow Angelenos, is an emergency. An OB/GYN at Kaiser today shared with us the story of delivering a baby while hearing 3 code blues sounding at the hospital. 1 new life was brought into Los Angeles as 3 lives were extinguished. Our healthcare professionals are stretched. Anybody working in a hospital is under incredible stress and strain. And they've learned, though, critical lessons from nearly a year of fighting this virus. And we're taking advantage of those lessons, turning hospitals into places that can surge their capacities in ways that they determine will help save the most lives. Thanks to our efforts and the city's partnership, we have enough PPE and enough supplies to weather the crisis in the next month or 2. But in the coming days, the county may be required to formally declare a system-wide crisis, indicating that all hospitals have run out of space and the staffing for that space. At that point, our countywide approach will look a little bit differently than we talked about at the beginning of this pandemic, when we had ships like the USNS Mercy or discussions about the convention center. Every active hospital has a detailed plan to surge where they are, detailing the steps that they have to take to expand capacity and laying out the standards for how doctors will begin to limit care. This may include repurposing non-ICU beds to become ICU beds. We have more ventilators than we had in March and April. How they might use large open areas such as conference rooms to receive patients or put up tents in the parking lot for triage and intake. They are working with the county to establish plans for rerouting patients from facilities that are already underwater to places that might have a bed or 2 left. And many hospitals are postponing elective procedures, a step we expect more to take in the coming days. The biggest concern, as I mentioned, for hospitals right now is staffing. And while they've gone to the National Register to bring in outside doctors and nurses, those registries are stretched thin. And if we're able to work with the state and county to bring in additional medical staff from other regions, hospitals have advised that it's best to concentrate those staff in existing hospitals instead of spreading them out to new facilities like the convention center. Our most important task is to listen to those lessons, to listen to our hospitals, and to empower and support them to implement their plans. And the city of LA will do just that. This is how we will save as many lives as we can, lives of people we know and love. And we continue to confront this health crisis. We will also be focused on protecting livelihoods as well.